All right. Welcome to Coffee with Cade. I'm super excited to introduce my fantastic guest. This is Joyce Reinecke, who is the Executive Director for the Alliance for Fertility Preservation. Joyce, welcome to lunch.
Thank you for inviting me. I'm thrilled to be
Yes,
here.
yes, outstanding. Welcome to lunch and to our very special Coffee with Cade about talking to your legislators and advocating and using your voice to impact the laws that are going to affect your opportunities. We're going to just chat informally for a few seconds to allow time for others to log on. I see we already have two people who have logged in. And so we'll just give a few more minutes. So how's the weather out there in California?
Actually, it's really not good and it's unusual. I think it might be hailing right now.
No!
Yeah, usually I can report that it's sunny and beautiful and in the 70s, but strangely, yeah, there's rain and it sounded like on my roof some hail.
Man,
So it's been a strange spring, I think, across the country.
it has been. I know on 3 days ago we had temperatures in the mid 80s, and this morning it was in the mid 40s. So I don't know what happened. I know we got someone messed angry, but I like those 80s. It felt really good.
Yeah, I agree with you. I was just in Maine and New Jersey and New York and had snow virtually everywhere we went. So,
Oh my
yeah,
goodness.
it's kind of a bummer for April.
Seriously. All right. Well, let's go ahead and get started. And then, as you know, or all of you all who are tuned in or who may be tuning in later, this will be available both on the Facebook site as well as on the Cade Foundation site. And I'm hopeful that Joyce will also post it on her website for people
Yep.
to see in the future. So, once again, I am super thrilled to introduce the Executive Director for the Alliance for Fertility Preservation, Miss Joyce Dillon Reinecke. Now, did I pronounce that
Thank
correctly?
you. Thank you, Camille. Thanks for having me here and for being interested, obviously, in fertility preservation for cancer patients and post-treatment options and, getting involved in advocating on behalf of patients and helping patients advocate for themselves. So something that we believe in.
And I believe in, and I celebrate, and I lock arms with you. So let's go ahead and get started. So can you tell a little bit about what fertility preservation is?
Sure. I think fertility preservation, when people hear that word or that phrase, they understand that to mean protecting your ability to have biological children in the future. So usually when we talk about fertility preservation, we're talking about fertility preservation that includes things like sperm banking and egg and embryo freezing, and kind of getting that biological material out of your body essentially and stored away safely so that you can undergo medically necessary treatment such as chemotherapy or radiation. So that's how we think about it. And I think it also would include some techniques, surgical techniques, such as fertility sparing surgeries for cervical cancer. Sometimes there are lesser impacting treatments for ovarian cancer. So there are some other techniques that are included in fertility preservation. And I would say also for those who don't have time, for women especially, who don't have time to do things like egg freezing or embryo freezing, there are experimental techniques that involve biopsy of ovarian tissue, and that is experimental right now, but it is happening, and babies are being born from frozen tissue. And there are experimental techniques also being studied and undertaken for boys for testicular tissue. So I would say that's kind of the scope. It's really doing things to minimize damage to the reproductive system, but also taking the the cells, the reproductive cells that we call the gametes, out of the body and freezing them away and protecting them.
Okay, so doing things to minimize damage to future fertility or future reproduction?
Yeah, I would say it's to minimize damage and protect one's ability to have biological children in the future. And so there's also a context for fertility preservation that we hear a lot about, I think, in kind of the broader media directed, just at the public. That's about egg freezing for what people call social reasons.
Uh-huh.
And most of that is just to guard against natural aging, where, women are really up against that time clock. And so usually your fertility really starts to diminish around age 37. So people do undergo fertility preservation techniques like egg freezing, in order to protect their ability to have children maybe when they're a little bit older, when they're in their 40s, because the number of eggs and the egg quality really goes down, once you're hitting into your late 30s. But when we at the Alliance for Fertility Preservation are talking about fertility preservation, we're generally speaking about people who need this for medical reasons. So that's primarily, cancer patients, but there are people who have other diseases and undergo similar treatment to cancer treatment. So, for example, sickle cell anemia, some types of lupus or rheumatoid arthritis, some of those patients also may have to undergo chemotherapeutic treatment or bone marrow transplants. And so they would basically then be at the same risk and have the same needs for fertility preservation as cancer patients.
Very good. Thank you for that background. Very, very interesting. So,
Sure.
What we already talked a little bit about, I guess in general, about the types of ways that the sex cells are harvested. Can you talk a little bit about options?
Yeah, sorry, talk about options for fertility preservation? Is that what you said?
Yeah, so in other words, what happens after the sex cells, the eggs and the sperm are harvested? And if you could turn your sound down just a little bit, because we're getting a little bit of an echo.
Sure. So yeah, it's very different if you're a man or a woman, obviously. The primary means of fertility preservation for men, for boys, if you're post-pubescent. So if you have entered puberty and you have to undergo potentially sterilizing treatment like chemotherapy or radiation, and you're a guy, the easiest and most effective means of protecting your reproductive capacity is sperm banking. And so that's been around forever, almost. And that's a pretty simple technique. If for some reason, sometimes cancer patients might be really too ill to undergo kind of traditional sperm banking. They might be in an inpatient setting or unable to produce a sample. There are also techniques that can be used to go in and kind of collect the sperm. So that's something to be aware of as well. Beyond that, as I said, if someone is pre-pubertal and male, the only option that's really available for them because they don't have mature sperm cells is to do testicular tissue freezing, which at this stage is considered experimental, but there are some facilities across the country that will be able to do that. On the female side, really, you can do egg or embryo freezing. And that has really been a new change, I would say, in the past maybe 5 to 6 years. So in 2012, the American Society for Reproductive Medicine, which is the professional organization for reproductive doctors, they acknowledged in 2012 that egg freezing had really gone from being what was considered an experimental technique to something that was considered standard and had really more reliable results and was close in efficacy to embryo freezing. So prior to that time, if you were a young woman, your only option was to do embryo freezing, which basically the techniques and the procedures that you go through for egg or embryo freezing are virtually identical. So you have to undergo a series of shots that will hyperstimulate your ovaries, and that means that you will mature multiple eggs instead of what's typically occurring in your body each month, which is the maturation of only one egg. So you hyperstimulate the ovaries, and then a physician will track you through ultrasounds and watch your egg development. And then what we call it is harvesting. They will go in at the end of the cycle and they will harvest the mature eggs. And so at that point, if you freeze the eggs, that's called egg freezing or oocyte freezing, and those are protected for you and they only contain your genetic material. If some people are married or have a partner and they're really comfortable with that, you could take the eggs that are harvested and fertilize them in the lab at that point with the sperm from your partner or from a donor, if that's what you wanted to do, and freeze embryos. I think increasingly for young cancer patients, if they are single or if they feel more comfortable, even if they're married, I mean, anyone can always make this choice. So egg freezing coming online as something that's looked at as standard has really kind of equalized the field a bit and the choices for men and women. So freezing eggs is much, more akin to freezing sperm in that it's only that person, their biological material that is frozen. So then, right, versus embryos. So when you get to a place where you're stable or you feel comfortable and you get kind of the go-ahead from your doctor that you could think about getting pregnant, that material then can be thawed, the eggs or the embryos or the sperm. So eggs or sperm at that point in time would have to be mixed with, the other gametes. So you either at that point would need sperm to fertilize the eggs, and then embryos are placed back into the womb and someone carries a pregnancy from that point. That's called IVF. That's in vitro fertilization. So that's how the material is used down the line.
Okay, that's good.
I don't know if you have any questions about that.
No, that's a lot of good information. Joyce, do me a favor and kind of tilt your computer down a little bit because we're cutting off a little bit of your face with the banner that shows what we're typing up. Yeah, that's better.
Is that better?
A little bit more.
Sorry, I'm on a surface. Maybe I just need to sit up.
Right now, we're kind of cutting off half of your face. When you tilt it up like that, that's good. That's perfect.
Okay.
All right. Well, that's good. That's really good information. All right. So what are some of the factors that, we talked about cancer being cancer and other medical diseases. Oh, your face went down again. There we go. All right.
Okay.
So you talked about cancer, you talked about sickle cell, other diseases where the treatment that may impact fertility, that may impact future fertility. These are all conditions where fertility preservation may be necessary. Can you repeat them a little bit so I can write all that down for everyone maybe watching it later?
Absolutely. So our organization, the Alliance for Fertility Preservation, we were founded with a mission, to raise awareness and help cancer patients get access to fertility preservation. But increasingly, we're having dialogue and we're hearing from other populations of patients, if you will, who are looking for this kind of option. And so I think increasingly we are going to see that. And so one of the populations that I mentioned, sickle cell anemia, it's my understanding from some experts that we've had dialogue with that increasingly they're looking to bone marrow transplants for that population. And I believe that's still being done on an experimental basis. But if patients are going to undergo bone marrow transplants for sickle cell anemia, it potentially can be curative, which is amazing. But the side effect, one of the side effects of the bone marrow transplant is that a patient may be left infertile. So getting those patients this information ahead of time so that they understand what their options are to protect their ability to have children is important. We have also heard from populations there are different autoimmune diseases. Rheumatoid arthritis is one. Lupus. So there are these patient populations that if the case is severe enough, the patient may progress to the place where they are undergoing chemotherapy, just like a cancer patient, that could damage their eggs or sperm. And so then in those cases, they would be in the identical position of a cancer patient who's seeking these services. I will say we've also talked to patients who have different conditions or diseases that can be inherited, and they can be interested in undergoing a round of IVF as well in order to screen embryos. So, for example, there's the BRCA gene, which is a gene that predisposes you to breast cancer and to ovarian cancer, and also actually raises your risk of some other cancers. And so we have talked to patients who are interested in, even though they may not yet have developed cancer, they may be interested in undergoing egg freezing, removing eggs, and actually testing for the BRCA gene in order to, screen that out of any, cell line moving forward. So that way they could then fertilize those eggs that maybe don't contain the BRCA gene and become pregnant that way. And then they wouldn't have that concern, for their children. Their children wouldn't be inheriting that gene, essentially. And so there are a variety of cancer conditions and other conditions, other genetic diseases that now can be screened for if you go through and harvest eggs and then use a technique called PGD, which looks for specific single gene issues. So that's a kind of a newer population that's looking at fertility preservation. We've also heard from members of the transgender community. So there are people who are interested in freezing their genetic material before they would undergo surgery to confirm their gender identity. And so that is an emerging population. And I think increasingly there's been attention on their medical needs. I think going forward in the future, and the more we learn about genetics, I think that this need is only going to expand.
That's outstanding. So there are a lot of groups who would benefit from the work of advocacy for fertility.
Absolutely.
So let's jump right into that. Can you tell me a little bit about what this means? Well, how do we advocate? What does it mean to advocate? And then we'll get into some of the different ways that people may get involved with advocating.
Yes. So we were just discussing, these various patient populations that need fertility preservation medically for some reason or another. But one of the key barriers that prevents these patients from accessing things like sperm banking, and particularly for women, the costs are very high for them to access egg or embryo freezing. And so what would be helpful, of course, because these are needed medical procedures, is if patients had insurance coverage, to cover egg freezing or embryo freezing. And unfortunately, in most cases, that coverage does not exist. So there are a few states. Last year, there were 2 states that passed laws requiring insurers to cover fertility preservation procedures in medically necessary cases like cancer. And so those states are Connecticut and Rhode Island. And depending on the level of interest, we can talk about how those laws differ slightly in their language and how they were enacted. But we have been working, our organization, the Alliance for Fertility Preservation, we've been working with organizations across the country in various states to support other bills that have been introduced in other states to try to also implement this coverage. And so right now, it's hard to say the exact number, I have to be honest, because it's a moving target. So there are bills that are sort of expiring and falling off and not being introduced. And then there are some even new ones that have just been introduced in the last maybe 2 weeks. So I think at last count, there were maybe 13 states that had legislation that was currently pending right now. And so in those, yeah, it's pretty amazing. I think people saw the Connecticut and Rhode Island bills, being enacted, being made law. And so a lot of these bills, legislators have just introduced on their own. And so our organization, for instance, hasn't necessarily been involved in introducing the bills, but what we've tried to do as a nonprofit is just provide as much information as we can to the state legislators. So now that a few states have gone through this process, there are some really good fiscal analyses of what these costs are. And so we've tried to provide those to legislators, who have concerns about insurance mandates or enacting new costs that might, fall to the state to cover. And what those analyses have shown also is that this is really a very small population of patients. So across a whole pool of insured people, the cost really is pennies per member per month. And so that cost can be spread out, across everyone, and which in our mind is really what the purpose of insurance is, right? It's that you spread the risk and you have this small cost that everyone pays in, and it guards against a catastrophic cost for individuals. And so I don't think we've discussed this yet, but I mean, people should know that for a cycle of egg freezing, for example, typically the costs can be around $15,000. So that can be really catastrophic and really not something that's available to every patient. So you can imagine out of the clear blue sky, someone is living their life, they're in college or they're a young adult, let's say, in a new job, and they get a cancer diagnosis. And so that in and of itself is devastating and scary.
Yes.
And then to understand that as a consequence of their treatment, they may lose their ability to have biological children is really, like a second blow. And when people find out that they have choices and options and ways to protect their ability to become a parent down the line, often they're elated, and then they get that third blow, which is the cost. And so for a young adult, I mean, to be able to marshal those kinds of resources and pay essentially cash upfront to access these services is really quite unrealistic for most people, because the patient hasn't even had time to, digest this and to think about it and decide, to save money or anything. You would really have to be available with that cash. And so time and time again, we've heard stories from patients who really cared about this and wanted to do it, and they absolutely just financially couldn't make it work. So that is really, I think, a devastating consequence, and not something that a young person should have to give up just because they were diagnosed with cancer. So that's sort of our position on that. So we've been trying to communicate that to legislators, to policymakers, to regulators of insurance in various states. We've had meetings and kind of laid out this case, that this is a medically necessary procedure that's really part and parcel of their cancer treatment, or, as we said, with other populations, if they have to undergo these necessary medical treatments, like chemotherapy or radiation or some surgeries to treat their underlying disease or condition, they should have this available to them to protect their right to be a parent in the future.
So we've had a question sent in. How does one become an advocate? And we only have a few minutes left, so we're tapering off. But really quick, okay. How does one get involved with advocacy?
Well, I can tell you can reach out to me directly at advocates at Alliance for Fertility Preservation. You can find out also we can help you with this. Identify your state senators and representatives, and send letters anywhere that legislation is pending. We have encouraged people to send emails, to call. I mean, really, legislators listen to those phone calls from their constituents. So for you to reach out, and I can get you a list of all the states where legislation is pending. But what we have found is we've helped patients actually, and lined up patients who have come to public hearings. So for instance, this happened in Maryland. We had this going on in California last year. There are other states, Illinois, where patients have been told about hearings, and they've been able to actually sign in and share their stories with the legislators at the insurance committee or health committee meetings. And I know, like, for instance, in Connecticut, that is really what saved the bill there. There was an amazing patient advocate who shared her story and really moved the legislators. And I think that there are patients who find sharing their story really empowering. And I think for the legislators to see a human being and understand how this impacts them, and not only them, but their entire family, how it impacts, their spouse or even their own parents. I think that is a really important part of this story that legislators need to hear firsthand.
So
you can absolutely.
We're almost out of time, but very specific.
Okay.
If I want to get involved with this, I can email you at advocate for Alliance for Fertility Preservation.org.
Yes.
Are there special advocacy opportunities? Is there a time where you go to Capitol Hill? Is there a time where you go to different state legislators? How can people follow? How can people figure out, that something is going on in their state very quickly, so that they could make plans to attend and be available to legislators? We are involved. There's going to be an advocacy day in New York on this bill that's pending in New York on May 8th. So if anyone's in New York and interested in joining us, I would love to have you and have you share your story. If you look at the Alliance for Fertility Preservation website, we have each of the states where legislation is pending is up. You can read the bill, and if something is going on currently in your state and you reach out, we can coordinate that and work with you to try to get you directly in touch with your legislators. And I have templates of letters that you can send and of course we want people to personalize it with their own experience, but we can help draft a letter so that you can explain your situation and your case and why insurance
insurance maybe would have helped you or changed the outcome for you. So there are a lot of ways like that we can get activated. So as states come online, we'll see if we have advocacy days. We haven't moved yet on the federal level. We have been focused on the various states, but as things progress, that of course may happen. ASRM, the American Society for Reproductive Medicine, is also having an advocacy training in Washington, D.C. on May 22nd. And on May 23rd, the following day, if people want to come to DC for 2 days, Resolve, which is an infertility organization that we've worked very closely with on some of these issues, that is their lobby day. And so there are a variety of infertility issues that they will be training people up to go speak about. But I will be there and we'll be speaking about fertility preservation. And so if people are interested in meeting with federal representatives, that opportunity will exist May 22nd and 23rd as well.
And I will also be there to represent the Cade Foundation. So I look forward to
good.
in person at that event. Now, I'm also on your website right now. Where exactly can I get the link to the things that are going on throughout the U.S.? Because I'd like to post that link.
Yes, there is a drop down, or I can send it to you, for advocacy.
Okay.
So under Get Involved, it says Advocacy.
Yes.
And if you click on there, you can go to the section that says State Legislation.
Got it.
And there are individual pages on every state. And the bills and the representatives who you would want to contact who are sponsoring the bills, they're there. And all the background information that we have on those various bills are on those individual state pages.
Okay, excellent. So, in short, there are abundant opportunities for people to get involved. I've shared the URL. Please, if you're watching this, go to the page on the Alliance for Fertility Preservation website to see the legislation that is pending for your state and get active.
Absolutely.
We've given you the information.
Absolutely.
For Joyce, where you can reach her directly, or you can reach someone at her organization. We've told you where things are happening. So it is your opportunity and your obligation to participate in this process. If you want change, be a part of that change.
Absolutely. And the other thing I was going to say, Camille, is that we have a section for share your story. And so it depends how public people want to be. But all of those stories, I mean, we print out, we share, we direct policymakers to that section of our website too. And I think it's important for the policymakers and legislators to see a variety of patients. So we like for them to see people of different ages who've had different types of cancer. I think it was very important. Last year, we had a really articulate young man who was 19 who talked about sperm banking, because sometimes I think that legislators think this is just about women, you know, and it does impact women more significantly because of the cost. But I think to hear from a young male why it was important to him to protect his ability to become a dad in the future, I think was really eye-opening. So to get a full range of patients who made different choices, different decisions, and understanding why, I think is really important.
That's outstanding. So we could probably spend a lot more time talking about this, but unfortunately, our segment has come to an end. So I'd like to thank Ms. Joyce Reinecke from the Alliance for Fertility Preservation for sharing all of this fantastic, essential information. And I challenge each of you that are watching this broadcast, this live stream, to get active, to get empowered, and to participate in this process. Thank you for participating. Yes, if you'll just hold the line for a second, I'm going to end the broadcast. Before we go, I want to remind everyone that we do have a Pathways to Parenthood coming up in Houston, Texas at the Wheeler Avenue Baptist Church this coming Monday, the 24th of April from 6 until 9 p.m. And I hope to see you there. And more information is available at the Cade Foundation website, www.cadefoundation.org. So thank you for tuning in, and we'll see you next time. Before we finish up, Joyce, you want to hold up your mug, your coffee mug?
Yes, I'm here. It's morning in California, so I'm drinking my coffee.
She's drinking her coffee, and
Thank you for having me.
Thank you for coming on, and I'm drinking lemon with honey tea. And so Joyce will be sending you your official Coffee with Cade mug to thank you for being a part of this very important discussion. So hold the line, and I'll
Thank you.
close out the broadcast. Y'all have a great day.
Okay.